wisdom to us. Here with us is Dr. Nick Wisniak. He's the founder of ProHealth Systems in Vancouver, Canada, professor of anatomy, author of many books, frequent guest here. And he'll be talking about being able to do some iStem for yourself at home when you can't get to your physical therapist. So welcome back to the show, Dr. Nick. I can't wait to hear what you're going to tell us.
All right, well, thank you very much for having me, Deborah. It's a pleasure to be here. And yes, absolutely instrument assisted. I'll show you really quick since we want to see the biggest collection. It's far away where we are right here. But if you look in that corner, that's about $50,000 of instruments right there. So yeah, over 120 instruments that we have. And even our collection is bigger than that. So we've done a lot of research on this topic.
And these instruments are shaped so that you protect the hand of the practitioner and you can do more refined work. Why don't you tell us about that?
Yeah, absolutely. We went through, okay, well, this is what we actually really did. We went on a world tour and we bought every instrument in the world that we can find, and we still buy them. And we came up with our own designs as far as what you would actually want to use to work in different areas where you could save your hands and still be more specific with the patient you're working with them. So if you look at the shape of this one right here, this is our ProStim blade. The shape on this one is very specific, different beveled edges, different corners on it to get into specific tissue regions. Like if I wanted to work into tendons of the forearm, I can go ahead here and just have this roll down over the side of the hand. I can use this edge, it's wonderful for the plantar fascia. So you name it, this over top of a thigh or a wider arm or something works really, really well. So lots of variations in real instruments. Now, what we're trying to focus on though is what can you do at home when you're trying to get through with this stuff. So Deborah, you've got some spoons there.
I do, I have 2 spoons.
So go ahead and just pick one of the spoons. The edges are going to be a little bit different and obviously not as therapeutic as a real instrument, but still something that you can use. So if you want, you can just hold a limb out and you can go ahead and just drag that instrument back and forth over top of the skin, nice and light. And you can feel maybe a little bit of a gritty sensation, a little bit of a stimulation right there.
Yeah, it's a little bit bumpy.
Yeah, absolutely. And that's super common, something we see with this a lot. So as you're moving back and forth and you find an area where maybe there's a little bit more bumpiness or maybe you're a little bit more tender there, as long as it's not too uncomfortable, you can work a little bit deeper into that region. If you wanted to add more to this, you could use something like a coconut oil. I'm a big fan of natural-based oil, so coconut oil on your skin, and we'll let the instrument slide over the skin easier, and you could work into deeper tissues, more specifically into those soft tissues that you want to work on.
You know, I just used the back of the spoon, and that felt really nice.
Yep.
Just
Absolutely.
using the soft edge of the spoon.
Yeah, so when you pick soft edges like that, soft edges are going to give you some nerve stimulation in the area. They're going to give a little bit of compression of the local capillary beds, and they're going to stimulate increased blood flow on a superficial level. And that's great. If you want to do something simple to see how you're doing, before you start, hold both of your hands out and just extend your wrists and see what your range is. And even now, for me, I can feel a difference from one side to the other. How does the side feel that you worked on?
It feels more flexible. Yeah. And all I did was, 2 minutes, not even.
Yeah, exactly. You're in there for 30 seconds or so, just rubbing over top of the area. And so it's a nice way for you to increase, short-term, increase flexibility. Now, again, it's going to be nowhere near as specific as what your healthcare providers can offer you.
So do you think that, let's say I have a healthcare professional who does iStem, you think they could guide you through your own little?
Absolutely, they could. You could book an online teleconsultation with them and they should be able to take you through it. Beyond that, yourself, once they give you some basic tips, it's just like stretching or exercises. They should show you a little bit and then you can run with it and decide what really works well, what doesn't really work well for you. The key thing is not to over-treat. If you over-treat with these things, they can cause more damage than benefit. So the dosing on these is quite a bit higher than you give with your own hands typically. So you have to be very specific when you're using these.
So a minute or 2?
Maximum, absolutely, yeah. If you go on YouTube and you type in Wisniak, what is iSTM? It's one of our more popular videos. I think we have over 250,000 views on it or something. We talk about it, what it actually is. And the dosing does need to be relatively low.
Well, thank you so much for taking us through that. I mean, it's nice to be able to use ordinary household implements to help yourself, especially nowadays when it's sometimes really hard to get in to see somebody.
Absolutely. You want to be able to help yourself as much as you can, but it's just like anything else. Even if you stretch or you exercise yourself, you do a certain job, but if you have that healthcare professional there with you, you wind up doing a much better job with it.
Yeah, I'm thinking that it would probably be better to call somebody in and have them guide you through it, just to be on the safe side.
Yep, absolutely.
All right. Well, thank you so much for sharing this wonderful idea with us. And thank everybody for tuning in and watching. We'll have Dr. Wisniak on the show again, I'm sure, soon. He's a fountain of information. So thanks again for coming. And thanks everybody for watching, and please subscribe.